Though maternal health care has improved over the past 20 years, the pace has been slow and extra effort is required for Ghana to achieve the Sustainable Development Goal 3 in reducing maternal mortality.
When you look at the statistics of maternal health in sub-Saharan Africa, Ghana is one of the countries not doing too well. We've made a lot of improvements in our democracy and our good governance. We have a lot of improvements in most of our educational sectors and other sectors. But then when you look at the health sector and when we consider maternal health, it's untenable and it's sad to know that we still lose women just because they got pregnant or just because they wanted to give birth to life. And for us, this is unacceptable in the 21st century.
In urban Ghana, 82% of women deliver in health facilities. This, however, is not the case in rural Ghana, as only 42% deliver in approved health facilities.
When you look at the antenatal records throughout the country, midwives normally register a lot of pregnant women. But if it comes to delivery, compare those registrants to the number of deliveries, you realize that half of them deliver in the homes more than the hospitals.
Apart from the government of Ghana providing basic resources for the reduction of maternal deaths, some institutions have spearheaded projects to even accelerate the process further. One of such is Send Ghana. In view of this, the Improving Maternal Health Services Through Participatory Governance was launched.
In terms of our relationship with Christian Aid and Send Ghana, we launched a call in 2013 under the Non-State Actors and Local Authorities thematic program. Christian Aid applied with Send Ghana as a co-applicant, where they work in the northern, the upper east and the upper west regions, basically trying to ensure that pregnant women survive maternal mortality.
A UN report on trends in maternal mortality rate from 1990 to 2015 indicated that though maternal health has seen significant progress over the years, the current level of 350 per 100,000 live births leaves much to be desired. The Improve project employs a unique approach of working through the governance structures and strengthen them to ensure better maternal deliveries. Dimabi, a community in the Talon district, used to access healthcare from Talon. Pregnant women had to cover a distance of about 10 kilometers before accessing antenatal services.
Sen Ghana mara kana kataman ma boite ti yongo tong ban puni yel mo sir shanga dem biete zang chang te bihawo lebago polo bi zang chang te bihawo nyang la bo polo katra to hawo fable wo ba bi to hawo ba kama te yongo yel shanga dem biene te ka ko nyul suma te ka banje te tang ban woni te ka shipte te tang ban woni to kab non te verle la ha te pa te papunum zambashi te yelwa yetolanka bikente zahna kabnon te vero bi bo boite ne ka dun chen toloma de vielte te bi de vielte te yaba de viela ama diri nyala yon baza de na vielte don sonan sonto yin chante zanka labna telande
de nan walago tolan nan walago ma banto nye zang moto zan wacha bitiyam pala tunje shamma karna mpon changwa ma ne zanma
There
was the felt need expressed by the people of Dimari to have a chief's compound within the community. This was discussed with the health authorities of the Tolan District Assembly, and at the end of the day, a decision was taken. Stakeholders, including their representatives at the assembly, their chiefs, they all had inputs into the execution of the project.
To te pa na on pan ne zela shiftima do yi papula wasra na yu kone won to cha ban to cha de ne to katamla suhro te yel jisi ne tam to po jisi to ka won da shel kana.
The District Health Directorate is anxious to get the project commissioned to enable them send personnel there to provide service to the good people of Dimabi.
The youth of Kwandema also constructed a footbridge to facilitate easy access to the Wiaga Health Center by women.
The footbridge construction came about when FISTRAD did a community sensitization at Pandema, and this was under the Improve project. During the sensitization, the community members complained about their difficulty in accessing the St. Lucas clinic in Wiaga. As at the time we did the community there, it was almost getting to their annual festival that they have every year. So they said they were going to table the construction of the footbridge at that festival. And from that festival, they will see how they can raise money to be able to construct the footbridge.
During the rainy season, the ambulance cannot even get there. So they will call us and then we'll pick the ambulance. We'll go halfway and then we'll call them to bring the patient to the nearest point so that we will pick and come. With the bridge, I know for time to come it will help because the time the bridge wasn't there, it was also a problem. The rivers are two, this bridge and another one in front. So it was giving us a headache.
This construction was done solely by the community members.
When this bridge was not available, access to the hospital was tedious, especially days for antenatal service. But now, the bridge will make it easy.
The Chips Company in Asigri serves a population of about 10,241 with 13 staff.
We run OPD services, we do maternity services, and among others. So it's more or less like a health center. So staff strength had to increase. And the more the staffs were coming, getting accommodation for them was a challenge.
Through the sensitization workshop organized by Send Ghana, the community saw the need to initiate a project that would provide accommodation for health officials.
It's just a 2-room apartment, which they have tried putting up. But for now, because of the financial constraints, if we would get partners who would hold our hands and help us complete this very structure, it will be of so much help to us. It will help us to serve the people better.
One of the remarkable achievements of Send Ghana's advocacy efforts is igniting the communal spirit within the project communities. Chasi, a farming community within Wa East District, is one such example. After a sensitization meeting in Jairi, a nearby community, the opinion leaders of Chasi were inspired by how the people of Jairi contributed to put up a security post for health personnel through their own efforts.
I came and called our community together. Then we look at our challenges and prioritize those challenges. Then we came out with this mobile clinic. Then how do we build it? Then we decided, then let's tax each other.
So we started the contribution small. Then the community elders also added some monies. Then we have mother-to-mother support groups. They also supported us. And anytime we have community deba with Send Ghana, then they have to give the community elders like cola or water for money for water. We just channel the money to continue with the project.
What I like most is the fact that we now have a health officer living with us in this community. This has offered 24-hour access, and we as women can discuss our health matters without being criticized. He comes to our homes and we feel very much comfortable. We want to thank the people who helped to save our lives.
The project set up district citizens monitoring committees who are made up of representatives of various interest groups in the district.
The Malafane, Ungari Yomodo. Dama Yomama, Ami and Jesu, Kakwanta, cut the deal was one up over for her. Ami she, Bangaka bang something and do no, Kafun Karati Master.
One key stakeholder of the improved project is the Ghana Health Service. The collaboration has resulted in the development of information, education, and communication materials, which is being used by the DCMCs and community champions in their sensitization efforts.
The children ward in Uchao was awarded to a contractor, and this contractor, the district assembly organized a community deba and informed the community about the project, which the community was happy, and the land or the site for the contract was sold to the contractor, and the community agreed that was the area they want the project to be located. The work is going fine, and the community, we do visit the site, and we are happy that project is moving on well.
The achievement of St. Ghana's improved project has been remarkable, and every effort should be made for its sustainability.
In terms of sustainability for this project, we have worked in building the capacity of the citizens groups. We've also liaised very well, I must say, with the local government structures, which are the district assemblies. They have been very collaborative, they have been very cooperative in this project, and we are very much assured that this project will not end even with the end of Improve.
We are very pleased with what we have seen in the field so far. We've been to the field a number of times, and we've seen that they're working closely with the district assemblies, with citizens monitoring groups, to ensure that people are able to access maternal health care at the local level, and they've reported accurately in terms of our requirements, both narrative and financial.
I also like to thank St. Ghana and Christian Aid very well. They have helped a lot. The male support these days, in fact, is very, very encouraging. I remember in July, we recorded over 300 deliveries, out of which over 100 males were involved. In October, we recorded 523 deliveries, out of which over 200 men were involved, some of whom, if it's cesarean section, accompanied their wives, stood by their wives, even during delivery and after. So we are encouraging more men to do same.
We as a country will have to make the necessary effort to make sure that no woman in Ghana is lost through the performance of her reproductive role.